I got it now. I'm here. I know I'm paused. I saw it in the bar down below. I saw it wasn't working. So again, DutyRon, retired NYPD detective, 20 plus years in law enforcement. Tonight, we're going to talk about the COVID-19 coronavirus. We are all going through it. There is nobody here in the chat that can't say that they are not affected by coronavirus, COVID-19. We're all on pretty much restrictions in our movement. We're only going out to get our essentials and things of that nature. There's a lot of people who have anxiety, stress, things of that nature. We're going to talk about it tonight. Katrina Katrest, thank you so much for the super sticker, super chat. Much love and respect. Guys, we are all in this together. We're going to get through it. We're going to make it. We just need to follow the rules, as Dr. Price told us last week in my last live stream. Hello, Paul Peck. Hello, Jonna, Black Rose. Guys, if you guys haven't noticed, I kind of cut back on some of the moderators that I've had in the past on the stream. I had way too many moderators, so I cut back a few. If those of you are in here realize that maybe you're not a moderator anymore on the live stream, don't take offense to it. I just had too many people to keep track of. Linda Halcrow from over in New Zealand. Kia ora. Great to see you. Thank you, Linda. I hope you're feeling better. She was tested for coronavirus recently. She won't have her results for another 5 days. So, guys, great to see you. Pia, girl, hello. Good to see you. Thank you so much, Daphne, for being in here. Black Rose, great to see you. So we're going to get right into it. Guys, as we all know, listen, we're all watching the news. Diane, thanks for joining. We're watching the news. We've surpassed 1 million positive cases worldwide. Here in the United States, the numbers are astronomical, and I'm going to show you the numbers. Eddie Fratz, good to see you from down in Florida. I hope all is well with you. Thank you for joining. Beanie Boomer, thanks for being in here. And if I haven't said hello to you, it's just I'm trying to stay on topic here. Hello, Lisa, Justin, and all the great ones here in the chat. I'm doing well. Thank you, Andrew. Appreciate you coming on in. And thank you, Angela ATF. So I'm going to switch right over. We're going to jump right into it. This is local coverage. We here in New York, as you know, New York in the United States is getting hit really hard. We're getting pounded with cases. We are doing a ton of testing, unlike other parts of the country. New York has the highest amount of saturation, so we are doing a lot of testing. So with a lot of testing, you're going to get a lot of positives, you're going to get negatives, but the numbers are going up because there's a lot of testing. NYPD, over 1,000 officers are sick from the COVID-19, and there's about 5,000 out on sick. So we have almost 1,000 positives throughout the NYPD. So we are getting hit hard. My brothers and sisters out on the front line, I tip my cap to them. But let me get into the nitty-gritty with you. Here's some local coverage. We're gonna cue this up real quick. So you can see in a 24-hour period, New York State has had 562 new cases, 43 in Nassau County and 9 in Suffolk deaths. So this is a serious concern to New York State. We're getting hit really hard. We're getting hit really hard.
An executive order to take ventilators and personal protective. Governor Cuomo expressing concern for Long Island as confirmed coronavirus cases continue to rapidly rise.
Long Island does not have as elaborate a healthcare system as New York City. We don't have the same amount of resources on Long Island, and we see an increase in the number of cases on Long Island, and that has us very concerned.
Cuomo reporting the highest daily increase in the number of COVID-19 deaths since the outbreak began, with 562 deaths statewide since Thursday, more than 50 of those deaths in Nassau and Suffolk counties. The governor issuing an executive order to take ventilators and personal protective equipment from institutions that don't currently need them.
We still have the challenge of ventilators. We don't have enough, period. But I'm not going to be in a position where people are dying and we have several hundred ventilators in our own state somewhere else.
Here in Nassau, County Executive Laura Curran says she is strongly advocating for the temporary hospital at SUNY Old Westbury, slated to accept non-coronavirus patients, to be a COVID-19 facility, like the decision made for the Javits Center in the city.
That is one of the next facilities that's meant to open. I was on a call with our hospital executives yesterday, and the consensus is it needs to be COVID so that we can get relief for our hospitals and for our healthcare workers.
Officials reporting more than 102,000 coronavirus cases in New York State, with a total of 12,024 in Nassau County and 10,154 in Suffolk County, an increase of
Those are astronomical figures. I mean, it is
nearly 3,000 cases on Long Island.
It is unbelievable here. New York State, 102,000+ cases. That's in one state. More than reported in China, more than reported in Italy, or close to it. Nassau County, the county that I live in, 12,024. Suffolk County, which is the adjoining counties, combined 22,200 or so, 22,000 and change on the cases. So it is troubling, it's disturbing, but we are doing the most testing. The most testing will get the most positives. A lot of the areas, you when you see numbers that are low, it is in part due to testing, not a lot of testing. So we have a bulk of the testing because we have so much density. New York City, which is 312 square miles in New York City, Manhattan. I'm only talking about one borough, Manhattan. There's 8 million people in 312 square miles. In the 5 boroughs, there's 23 million people. That's Queens, Brooklyn, the Bronx, Staten Island, and Manhattan combined. So there's a lot of numbers that are skewed due to lack of testing. In other words, there's a lot of sick people who have coronavirus that is not getting counted due to not being tested. A lot of people are home and they go through the virus, go through the sickness, and totally undetected. So the testing is where the numbers are. So these numbers, you could take them and triple them. The worldwide numbers are 1 million. It's probably close to 5 million worldwide, because many people are not being tested and have the virus, and then they correct themselves, and it takes its course, and they go through it, and they fully recover, and they're never counted. So that 1 million should be probably around between 3 and 5 million.
Since Thursday, but Suffolk County Executive Steve Ballone reminding residents of good news, that there are coronavirus patients being discharged from hospitals.
Those who get the most sick go into the hospital. They do get hospitalized, and they do recover, and they do come out of the hospital.
The new normal means mostly empty streets, except at testing sites. The line at this AFC urgent care in East Meadow snaking around the block. And for those working to save lives, messages of thanks at Huntington Hospital.
Dear doctors and nurses, thank you for helping people with illnesses so those people get better. We couldn't get through this without your help. We know you are tired and working so hard. We hope you stay healthy and safe too. That's from Harrison at Bayless Elementary School.
Amen to the hospital and healthcare workers all throughout the world. These are men and women who are on the front lines, putting their lives on the line day in and day out, not just during a coronavirus pandemic, but these brave women and men are out there on the front lines day in and day out, risking illness, disease and things of that nature. But now more than ever, they're seeing in front of them many, many people who are dying alone because they're, they're being isolated due to the disease, due to the virus. And these people are going through not only psychological and physical torture, the long-lasting effects that it'll have on this group of people in the healthcare field is unknown long term, but it's not going to be good for them. So I say prayers and I give thanks and praise for these brave people.
Legislator Joshua Lafazan delivering these letters from students in the Syosset School District to those on the front lines of this pandemic.
If you were to enter our hospital right now, you would see a blur of blue and green gowns, scrubs, headgear, face masks. But beneath it, I see their eyes. And when they hear loving, encouraging sentiments like this, they're smiling.
Cecilia Dowd for Newsday.
Okay, guys, I'm going to segue off of this and bring up. Hold on a second. Let me bring up the figures here. This is disturbing at best to look at this sobering number here. So 1,099,389 cases worldwide. 58,900 approaching 59,000 deaths worldwide. The recovered number is encouraging. 22,603 have recovered from this coronavirus. So this is a look at worldwide, and I'll go over to the next model here is 277,000 for the United States. This number up here in the top left. Let me move it over so you guys can see it. Top left here is 277.9, approaching 278. 7,150 deaths in United States, and 9,823 have recovered. Let me move this over. You guys can see it. There's your recovered in green in the top right. If we go to the admin one, it's going to show us counties. Here's New York City. Confirmed cases in New York is 103,060. That's just in New York City. That's the 5 boroughs. I'm going to tell you a little bit about New York City. I'm going to give you, let me just put on the second. Okay. I'm going to give you a little bit, and again, these numbers, like I said, are frightening to see, but we need to take them and put them in perspective. While I was a police officer in New York City, I worked in various different units, but towards the end of my career, the last 10 years, the last decade, I worked in the warrant squad. So what I did as a New York City police officer is I worked in the 5 boroughs, and it was in Queens, Brooklyn, the Bronx, Manhattan, and Staten Island. Not so much Staten Island, but I was in Queens a lot, and I was in Brooklyn and Manhattan quite a bit, and the Bronx a little bit, but mainly Queens and Manhattan and Brooklyn. So those were the boroughs that I covered. But when I did warrant enforcement inside of Queens, I just got to tell you that when I did the enforcement in Queens, Barbara, thank you so much for the super chat. She says, "You are truly a wonderful human being, and I appreciate you. We need you. We need more of you in this country." Thank you, Barbara. Amen. I need more people like yourself. So thank you for that, Barbara. So what I'm trying to say is while I did the warrant enforcement in Queens County, I witnessed a lot of families that when we would go out to look for somebody, we would have, warrant sheets of people, faces, pictures, addresses, and pedigree. And when we would go into the apartments, in Queens down by Elmhurst Hospital that you hear about on the news. Elmhurst Hospital is being overrun with coronavirus cases. There's refrigerated tractor trailers outside as makeshift morgues for overflow of deceased from COVID-19 and the regular mortality that they have at the hospital from regular people passing away. What I saw with my own two eyes is we would go into apartments looking for one individual or two individuals, and we would see a 2 or 3 bedroom apartment that should have 8 or 10 people in it, with 20 or 30 people in the apartment living, sleeping on the floor. They would take bedrooms and sublease them and put up a makeshift wall, and you'd have one family on one side with 4 or 5 kids and the mother and father in one bedroom, and then there'd be like a partition, and there'd be another family on the other side. So we used to refer to that as House of Horrors, not because it was a horror or a crime scene. It was just a lot of people. And this is going back a long time ago. This is going back more than 5 years, 6 years ago. And we would go into these apartments in Queens and see so many people living in such cramped quarters. They would take a 3-bedroom apartment that should hold 8 or 10 people max and have 30 or more people living in it, sharing the same bathroom, sharing the same kitchen, sharing sleeping quarters. And they did this because it is the high cost of living in New York. People can't afford to pay the rent, so they would sublease. Landlords wouldn't know about it. It was illegal, but I saw it with my own two eyes, and now I put 2 and 2 together, and I see the cases and the multitude of positive cases in Queens, in that very same area where Elmhurst Hospital was. I did warrant enforcement over there, and we used to dread going out looking for people because we'd have to look through hundreds of families inside cramped quarters. And this is a very prime example of how disease and a virus like this could get spread so quickly and amongst so many people, because all it takes is one person to be positive and living in that cramped quarters, sharing all of the facilities and, cleanliness, and, you can infect that whole location. And then all the people that they go out and interact with, if they work or, everyday stuff, now you have this spread. So, density is a big problem inside these neighborhoods where you see the spikes in New York. So let me highlight some of the other places. New Jersey has 29,000, almost 30,000 cases, 29,895. Michigan has a spike going on right now, 12,744 on the cases. Positives, 646 deaths in New Jersey, 479 in state of Michigan. California, 12,500 and 278 deaths. But don't be fooled by these numbers, because these numbers will climb. We're looking at the apex in 2 weeks. Governor Cuomo and elected officials are talking about the apex in 2 weeks. So let me show you another video. This is from yesterday from Governor Cuomo. Stand by for this one.
When this is over, I promise you I'm going to give them a piece of my mind.
Governor Cuomo not at all happy with the federal coronavirus stimulus package, saying it doesn't give New York enough help, as confirmed cases in New York State soared past 37,000. Nassau reporting a total of 3,914 cases, and Suffolk 2,735.
For the 8th day in a row, there are 2 additional fatalities related to the COVID-19 outbreak. The first patient is a male in his late 80s with underlying medical conditions who died at Southampton Hospital yesterday. The second patient was a resident from Peconic Landing who also was male in his late 80s with underlying medical conditions.
I'm sad to report that we have 2 new fatalities from COVID-19, a 59-year-old woman and a 66-year-old woman who lived here in our county.
Officials say 39 members of the Nassau County Police Department have tested positive for COVID-19. One is in the hospital. The police commissioner says he is improving, and the commissioner says some of those who tested positive have already recovered. Suffolk County Executive Steve Bellone once again implored residents to practice social distancing and isolating as much as possible.
You want to support healthcare workers? Follow the guidelines. If you're a small business, if you're a non-essential business, make sure your business is closed. If you're essential, God bless you. Thank you for what you're doing.
County parks are open, but Nassau County Executive Laura Curran is pleading with parents to keep kids off the playgrounds.
We do not have fences around many of our playgrounds. We can't literally lock them, so this is where we need parents' help. If you're going to the park with your kids, which I encourage you to do, staying with your household, not commingling with other people, keep your kids out of the playground.
Curran says she believes schools are not likely to reopen on April 1st, but that didn't stop the staff of Levittown's Summit Lane Elementary School from cheering up their students. They staged a parade of cars, featuring lots of waves and honks. One teacher dubbing it Summit Strong.
They're a little bit sad and a little bit gloomy, and we need to cheer them up, and we need to see them too and cheer ourselves up.
Very happy to see them all.
I really appreciate what they're doing because staying at home is not easy.
Hopefully lift everybody up in this very trying time.
Cecilia Dowd for Newsday.
Okay, so those are some of the local stories here in New York and Nassau County. So again, we have to understand that this is something that we're all in together. We got to follow the rules. We have people who have underlying health conditions, but we're seeing that that's not what's happening here. Everybody is susceptible to catching this. This is not now an old person's virus or disease. This is not a sick person or people with underlying health. There's people that have plenty of healthy people are getting this. So follow the rules, clean your hands, don't touch your face, don't go out in groups, don't keep that 6 foot or longer. You could keep a 6 or 8 foot distance from people, do that. Wear the mask. They're talking about covering up your face. Bandana, paper mask, anything when you have to go out to go shopping. Right now, our best defense is educating yourself with infectious disease. Dr. Fauci and some of the great ones that have been around for H1N1, so swine flu, Ebola, and so many different infectious diseases throughout the times. These are the people that you should be listening to. CDC.org is also a great place to go. Hey, hello, Marcelo. Good to see you. That was a hell of a mask you were wearing today in Costco or wherever you are. 1 in 5 NYPD cops are out sick. It's over 5,000. I personally know 3 who have coronavirus tested positive for COVID-19. So I'm gonna play a video from Fauci. Let's listen to Fauci. I like this guy. Let's listen to him for a minute. He's a good. Here we go.
Monday.com is a platform to manage your entire marketing.
We gotta wait for this
from content
ad to
creation
play.
and
Let me get this off until it's ready to go. All right, we should be ready to go. Here we go.
Dr. Fauci, thank you for your time this morning and for your tireless service over these last several weeks and years. As we heard from the president all last week, he was hoping that we could reopen the country by Easter, but of course, we saw that extension of the guidelines yesterday. Take us inside that decision. What convinced the president was necessary? What convinced you?
Well, it was clear, George, that the dynamics of the outbreak, what was going on in cities like New York City and Westchester and New Orleans and others, was clearly still on an uptick. And to pull back the mitigation methods before you reached the peak and turned the corner, I think really would have been imprudent, because that would have merely regenerated the spike to go up. So we had some intensive conversations with him, and we convinced him. He listened, and we said the better part of valor would be to extend them until the end of April, when we think it would peak and start coming down. I mean, these are all projections, but the thing we were pretty sure of is that if we prematurely did it, it would likely rebound, and that's one thing you did not want to happen.
You talk about the peak at the end of April. The president seemed to say yesterday that the models estimate the peak death rate in 2 weeks. So which is it? Is it 2 weeks from now or the end of April?
Well, what he was saying, that the number of deaths would probably peak by a certain point, but you still get a number of cases that go up, which will ultimately lead to less death rates, because the cases anticipate the death rates. What he was saying, that we had such a surge earlier that within 2 weeks you're going to have a peak in the death rates. The death rates start coming down, but you have another curve, which is actually the new infections. So they're complicated curves that overlap each other.
And the death rate numbers are pretty stunning. I mean, 100 to 200,000 lives could be lost. Are you all estimating that even if these guidelines are extended?
Yeah, I mean, even if these guidelines are extended, we will lose more people. Exactly how many more we would lose is uncertain, depending upon the efficiency of the mitigation methods. But clearly, what you saw yesterday and the day before, that within 1 day, we doubled the number of deaths. I mean, it was just really very, very sobering.
It is sobering. Of course, all of us here in New York are dealing with it. New York has been described as the epicenter of this virus.
And this was 2 days ago, so the numbers are continually rising, and they're saying the next 2 weeks it's going to just get worse. I don't know how it could get any worse, but unfortunately, I think history shows from other models and from other countries that we're not quite at that apex, at that peak. And, you know, I'm hoping that they're wrong, but it doesn't seem like they are, because I watched footage from January 21st. I'm not gonna get you guys to watch this, because I already watched it. I have video of conversation with Fauci and with other infectious disease specialists that talk about from January 21st to current, and the way the language and the way they were speaking seemed like it was like, you know, in the beginning, not a big deal, nothing to really worry about, and then it just went full out, you know, balls to the walls with, you know, where we're at today. But again, I'm not a panicker. I'm not a worrier. I have concern, and I'm definitely worried, but I'm not feeling like this is the end of the world and we're all going to die. That is not in any way, shape, or form what we're looking at here. What we're looking at is we need to stay inside. We need to go out and get supplies just to maintain food, nutrition, healthcare if you are sick or injured and it's very a necessity. If it's something that can be put off until after June or whenever, after the end of May, then you want to hold off on that. You know, I'm still going and traveling. I'm part of the necessary workforce with security. I'm still going to work, but I'm taking severe precautions at work. So, you know, I wear I wear a mask that is something that you would see at a construction site, and I don't wear an N95 mask because if I had one, I would give it to a local healthcare place. I'm not wearing an N95 mask. I'm wearing what was given to me by the NYPD after the SARS scare, when they were mailing when we had the SARS virus and anthrax and all that crazy stuff that was getting mailed into New York City and all the media after September 11th. So I have a biological chemical kit that I was given by the NYPD. It's got a full face shield that has a rubber gasket around the neck. I haven't taken that out. I looked at it, but I wear the highest possible mask that I could wear given the situation when I come in contact with anybody. So if not, I'm locked inside my office and I wash my hands like crazy. So let's let the rest of this go. It's almost halfway done.
Here in the United States right now, what other areas are concerning you right now?
Well, certainly New Orleans, George, is in that area where it's worrisome because the spike and the peak and the dynamics of that curve are starting to resemble a bit of New York. It's a smaller city, obviously, so they can't be totally comparable. But the dynamics of the outbreak in New Orleans are worrisome. We're also worried about Detroit. Detroit is starting to show some signs that they're going to take off. LA we worry about. Even though they had an early start, they calmed down a little. It looks like that they may have the opportunity and the misfortune of spiking up. And if you look throughout the country, there are a number of smaller cities that are sort of percolating along, a couple of hundred cases. The slope doesn't look like it's going up. But what we've learned from painful experience with this outbreak is that it goes along almost on a straight line. Then you have a little celebration, then it goes way, way up. So we've seen that in New York. Our European colleagues have seen it in Italy and in France and in Germany and in Spain. And it's a rather consistent pattern. It looks like it's low level, it starts to accelerate, and then it really goes up. That's the thing we really got to be careful of. Well, we're going to have all of these little mini outbreaks throughout various cities in our country.
That's exactly what I was just talking about.
I mean, the president said he hopes to have the United States well on our way to recovery by June 1st. Would that take extending these guidelines beyond the end of April?
You know, I think April might do it, George, but we kept an open mind. When we presented it to the president, we said 30 days is a solid. I think we should do it. 15 days was too little. None of us felt that 15 days
Jack's
was adequate.
mom, welcome in. I hope you're feeling better.
The obvious question,
hello,
which is a
Scout Inquirer.
Question.
Winky, everybody, Joey, thanks for joining.
That
Bridget.
we may be able to go past 30 days. We said we didn't think so, but there's always that possibility depending upon the efficiency and the effectiveness of the mitigation methods.
Finally, sir, what's your best hope right now for getting treatments on the market as quickly as possible and a possible vaccine?
Well, we have a couple of clinical trials that are accruing now over 200 patients with one drug called remdesivir. A couple of other drugs are being tested and some in early stages of development. I would think by early summer, late spring, we will get a signal on one of those drugs to see whether it works or not.
Hi, Brooke. Thanks for joining. Faithful One, good to see you.
And if it doesn't, we'll just get it off the shelf, get it off the table because it won't be usable. But it takes about a year to a year and a half. Good to be with you, George.
So here, he just finished up by talking about some of the vaccines and things of that nature. Again, I like to give thanks and praise to all the frontline workers and healthcare, first responders, the EMS, fire department, all of these men and women who are out there on the front lines. These are people who are taking the brunt of this. And I got to say, special thank you to all the people who keep our grocery stores, the shelves stocked, the truckers and all the warehouse workers and the people that keep everything going, the restaurants that stay open for takeout. These are great people who are risking, it's a very serious health risk to be out there. So kudos to those men and women who are out there and doing the job, the gas stations that are staying open, and all of these people that are out there on the front line. No matter what you do, if you're dealing with the public, you are a brave person to be out there, because most of us will stay home and we will worry and we will say we got to keep ourselves safe. So what about these people that are out there every day that have to report to work? So we got to give thanks and praise to those people. And at the end of the day, listen, we're going to get through this. And I keep telling you guys, there's no reason for all of us to panic. Do not watch. Michael B., Truck Drivers Rock. Absolutely. Thank you for joining, Michael B. Channel members, thank you so much to everyone who is a channel member here in the DutyRon family. I greatly appreciate you. Thank you to everyone who is here. Just being here and positively interacting means a lot. I don't know why that's happening. Let me see if I can get that off the screen. I don't know why there's double chat here, Josh. Is there a way I can get rid of that? somehow. Why did that happen? Just out of nowhere. How do I get that off? That's never happened before, Josh. How do I get that out? Does it go away if I do that? I got to get it away. Why is there double chat on there, Josh? I just noticed that. How long has that double chat been going on there? Jeez Louise. Yikes. How long has that been there? The double chat. Okay, this is a good one.
Somebody get me pads and a board now.
Code rapid and then a code blue. It's a look inside hospitals dealing with an unrelenting enemy.
That red dot, by the way, stands for this patient in this room has COVID.
Seen through the eyes of Dr. Karen Friedman, who oversees med school residents in the Northwell Hospital System. North Shore is located just outside of New York City, in one of the most inundated suburbs in the nation.
Patient went into cardiac arrest. This is on a COVID unit. They're now trying to resuscitate the patient.
In this pandemic, we really have had to go away from what we consider our real educational mission at this point in time because we have such a great service need to take care of patients.
Third-year residents are now fighting the onslaught head-on.
I'm good. Yeah, tough weekend.
With the next stage of the virus poised to move beyond the big metro areas, these medical professionals represent what may be in store for the rest of the country.
I'm having conversations with leadership about who in the future will be appropriate to actually put on a ventilator and who will not, based on age and the likelihood of them surviving, and those are going to be really hard decisions.
I don't know what we're going to do.
Welcome
for Dr. Friedman and her residents, this pandemic is personal. Like being asked to call the wife of an elderly COVID patient who could not breathe enough to talk to her himself.
And he said, I just want you to tell my wife that I love her and I hope she's okay. And my intern and I walked out of the room and cried outside of the room.
That man died less than a week later.
Almost 90% of my residents are taking care of only COVID patients at this point in time.
Going through training, we never talked about pandemics. We never talked about what we would do in a pandemic because we just never thought it would happen.
All of that extra work, they say, is well worth it every time they send a survivor home to their loved ones.
I come home to my family, my husband, he's like, this many people died today. And I'm like, well, these are all the people I saw go home today.
Imagine this,
So that was nice. She turned it around. He said, how many people died? And she said, this is how many people I sent home today. So that was a good thing. Here, I want you guys to listen to this. This is one of the reasons why I scrolled here. This is the Surgeon General, Jerome Adams. He is a very intelligent person, and he knows about infectious disease. Let's listen to him talk. He says a lot of sensible things.
Joining us now is U.S. Surgeon General Dr. Jerome Adams. Dr. Adams, good to see you again. Let's start right there. I think we've just laid out the debate. So my question to you is a real simple one. Do you expect the CDC to change its guidance and suggest that Americans should wear some kind of face covering when they go out in public?
Well, thank you for that question. It's important to know the CDC, the World Health Organization, and my office originally recommended against the general public wearing face masks based on the best available evidence at the time regarding whether or not they could prevent people from catching the coronavirus. We are learning more and more about this virus, as Kate mentioned. We now know that there's a significant amount of asymptomatic spread, and the task force has asked the CDC to look into whether or not we should change our recommendations to prevent people from spreading the novel coronavirus. But here are the important points. If you're going to wear a face covering, please try not to touch your face. Please be very, very careful about making sure you don't touch your face. Number two, if you're going to wear a face covering, please save the N95 mask for healthcare workers who need them. And then number three, wearing a face covering does not mean that you don't have to practice social distancing. the most important thing you can do is stay at home right now. And we don't want people to feel like, okay, I'm covering my face, so now it's okay for me to go out in public.
And on that topic, yesterday the White House had a very sobering briefing, put a chart up that said, if we do social distancing correctly, everyone does it correctly, we're looking at 100,000 to 240,000 deaths.
Okay, again, face mask doesn't mean a hospital N95 mask. People in the chat, I saw Lisa put up what masks. You could take a bandana and put it around your nose and your mouth, and that's considered a mask. You could take a scarf, put it around your mouth. Let's be sensible about this, people. They are telling us all the time and time again, the mask is really there to stop you from taking your contaminated hands and rubbing your face with it. Your nose and your mouth is where primarily a high percentage of coronavirus positives are from the hands to the mouth. And if you take precautions to cover those areas when you're out in a contaminated area, example, outside of your house, this is a very effective way of stopping from spread of the disease. We want to stop spreading it. So it's good. It's good, Sophia, that you don't go out without a mask and gloves. Awesome. All right, so these are projections right here. And this is a model, and this is a projection, 100 to 240,000 deaths. That is a very big, scary number. And I don't like it one bit. I don't like that they put this out. You know, at the end of the day, this number, I don't like it, you know, but we as human beings touch our face. We don't realize it. You get an itch, you touch it. It's not about being a baby. It's not about things like that. This is human nature. They say that people touch their face thousands of times during the course of a busy day. I don't know how that's possible because I don't keep track of it. But people do touch their face. You get an itch, you scratch the inside of your nose. You get an itch, some people. I see people in restaurants picking their mouth, taking food out of their mouth with their fingers. It's disgusting, but people do it. If you get an itch in your eye, you're going to itch it, and if you're contaminated on your hands, then boom, you have the coronavirus. The 100,000 to 240,000 deaths. That is not a fair number. I don't like it. I think it's bullshit. And I think this also adds to fear in most Americans and most people, not even Americans. People look at that and say, holy shit, that's scary. I hope and pray we're nowhere near that. But unfortunately, this is every day when I wake up, I go right to the model and I look at the numbers, and every day, I'm not shocked anymore, but every day I look at it and I just sit back and say, wow. So these are cases of, you know, situations that we have no idea of how this is spreading so fast. But at the end of it all, you take the precautions, you educate yourself, and you do not you follow the rules. You have a higher chance of not getting it than if you don't follow rules. I look at the numbers and they are putting out, and how many people have died in the world, and it doesn't add up. I don't have time to start. I get what you're saying, brother, but I don't have time to start questioning things. I want to take what the CDC is telling me and what some educated people, like, as much as you might not like Dr. Fauci, I like the guy because I don't think that he has bad intentions or bad vibes. I get a good vibe from him, and I'm pretty good about vibes. So I want to educate myself and cut the chances down, the risks. If I can cut my percentage down by 75%, then I say to myself, I want to go this route, because I'm not a conspiracy theory guy. I don't like to try to get into this whole fear. People send me shit all day long about if you can hold your breath for 10 seconds and you do this, then you don't have it and you don't cough. I fucking delete that shit right away as soon as I get it. It's just, I don't pay attention to Facebook for news for my own health and life and death news. I don't go to Facebook. So for those of you who share stuff with me on Facebook in a private message, I go to CDC. I go to the CDC and I look at stuff that I feel is reasonable. All the shit that you see on Facebook is just a bunch of fear-mongering nonsense. And if you're watching those videos and all that crap, then shame on you. You're going to get yourself scared shitless.
That's in this country. Are you concerned that as we sit here this morning, 17 states still don't have stay-at-home orders?
Well, yesterday was somber news, but there was also good news buried in there. The somber news is that coronavirus has spread all across our country, all 50 states. No one has been spared. The good news is that states like Washington, like California, countries like Italy, when they leaned into aggressive mitigation, they're being able to flatten their curve, and we know that if you do this, that it usually takes about 3 to 4 weeks from the time you start to lean into it before you level it off.
Well, that's exactly right. I mean, I guess that really underscores the question I'm trying to ask here, which is you're saying the states that did it and have these stay-at-home orders are already seeing the benefit of it. We've got 17 states that haven't. Shouldn't every state in this country have a stay-at-home order? Is this question?
Well, that's the whole point of these 30 days to slow the spread guidelines that we put out. We want nationally people to understand the importance of social distancing. We live in a nation that has a system of federalism, and the governors get to make the decisions, but we're going to give them the best possible guidance we can, and that's to stay at home and to social distance.
Okay, and sorry for the interruption, but unfortunately, these are urgent times. Let me play you something from Florida's governor. He said he has not received a recommendation for a statewide stay-at-home order from the federal government, and he's waiting for that. Let's listen.
There's no lockdowns anywhere.
The task force has not recommended that to me. If they do, obviously that would be something that would carry a lot of weight with me.
So he's saying he's waiting for somebody at the White House to tell him to shut it down in Florida. What would your advice to him be?
Well, my advice to America would be that these guidelines are a national stay-at-home order. They're guidelines that say that, look, the more we social distance, the more we stay at home, the less spread of disease there will be.
Is there any good reason for a governor not to have a stay-at-home order right now?
Well, governors have tough choices to make. They have to decide whether or not they feel like their citizens will listen to them without a stay-at-home order. But again, the most important thing is to stay at home.
Okay, so he just held up that sign and said, this is basically a national stay-at-home order. If the governors in your state decide not to enact it, I say this, use your head, look at the information that's in front of us. They're not saying that we have to stay locked up inside our houses. You guys see, I go out to the park, I walk around, and I keep 6-foot social distancing. I don't let anybody come up on me. As a matter of fact, if somebody tried to come up on me, I'll be honest with you, if I didn't know the person, and even if I did know the person, if somebody came up on me now in public, I would immediately push them back. Like, I would get physical with somebody if they came up to me in public. I'm telling you right now. I know it's not going to happen, but if it happens, if I'm in public and it's me and my wife or I'm by myself and someone tries to come up on me, I'm going to consider that a threat and I'm going to knock that person away from me as best as I can. And I'll do whatever I have to do to keep myself in that distance, and I'll verbalize it as the person's coming. So, at the end of it all, guys, we have to maintain that distance for safety. Okay, but I'm not going to be out. 6 foot is fine for me. If you feel it's not, then, make it 12. Whatever you're comfortable with. But for me, I know the science of it. And if someone does not spraying out spit and coughing all over the place, and it's just a person walking by you, 6 foot is reasonable for me. So you didn't hug anybody, Joey Brooklyn. I know you wouldn't even come anywhere near me. So, at the end of it all, folks, it's a temporary situation. This is not for the rest of the world, for the rest of the time. We're not going to be really divided forever. This is temporary. We will get through this. I'm going to play a video for you guys now. Is pertaining to New York, okay? Stun gun is a little over the top. I think verbally or pushing somebody arm's length away from you if they come at you, and pushing them and backing up would be fine. There's no reason to start assaulting people, guys. Don't take what I'm saying the wrong way. I'm not talking that I'm going to assault somebody, but I'm going to make some strong verbal commands Like, hey, back the fuck up. Get away from me. I'm telling you right now, I am armed. Get back. Go away from me. And if they don't understand that, then it will get physical. But I'm going to give verbal commands first, just like I did when I was a police officer. Hey, back the fuck up. Back away from me. This is a matter of life and death here. I'm not getting sick. Back up. And if the person keeps coming at me, then I'll make the necessary adjustments. The necessary adjustments. DutyRon will make the adjustments. All right, let's let this finish.
Home. Stay 6 feet away from each other. That's how you slow the spread.
We saw the timeline yesterday, and it's you've talked about the 30 days. And I remember you were on with us when we first had the initial 15 days, and you were very straightforward. You said it could be longer than 15 days. Sure enough, here we are. We now have another 30 days of social distancing required. But when you're talking about what's needed and what's ahead, isn't it very likely that the social distancing will have to be longer than even this 30 days? In other words, past April 30th, in order to contain the spread and get that optimistic scenario of 100,000 to 200,000 deaths?
My answer would be yes to that.
Well, that's a great question. And what we've always said is that everyone is on a different place on their curve. Some places aren't going to hit their peak until after 30 days, and they're going to need to continue social distancing. Other places that leaned in early may be able to relax some of their recommendations earlier. And when we say relax, we're not going to go back to saying, hey, well, I've never said as Surgeon General you shouldn't wash your hands or you shouldn't cover your cough. But we're going to start to look at how we can ease people back in. And that's one of the things we're looking at with the mask recommendations. Is there a possibility that we can use cloth mask to allow people to start to come back together once they've gotten over their peak and flattened their curve? These are questions we have.
Yeah, I hear you on everybody's going to have a different situation.
Okay, Nacho Friend, I have to stop this. Nacho Friend says, she says, bags in grocery stores, employees bagging and stuff freaks me out too. All right, listen, I'm going to give you what I do, and you guys can do whatever you want. If I get a package from Amazon or if I get something from the grocery store, I take the contents out, either in a safe place or in a controlled space, whether it's my granite kitchen countertops or any porous surface. I put it on the countertops or on my table, which is glass top. I take the contents out, I put them in my refrigerator, and I discard the bags. And then I wash my hands. I don't touch anything else. I go right to the faucet. I open up the faucet. I clean my hands vigorously. And then I clean the surface where the bags were. Everything's outside. All the bags are discarded. And then I clean that surface. And then I wash my hands again. So it's 2 washes. And if you do that, nothing's going to be on you. Nothing's going to be on you. No virus is going to stay on you after washing twice like that. So that's what I do. I've been doing that for 3, going on 4 weeks, and I'm not sick. I've been going to work every day. The product itself, you could wipe that down with a antiseptic wipe if you feel a need to. I've never done it. I got 3 or 4 loads of grocery, 3 or 4 loads of groceries in my refrigerator and in and out, and nobody here in my house is. Everybody in my house hasn't left other than me and my wife to go to grocery shopping. And my sons have gone out just to take a ride to get some fresh air and walk around. So, it is what it is. Better late than never, red like wine. So they're not using bags in New York. There you go. I went to Walgreens and I got a prescription today, Diane, and it was in a brown paper bag. So I took the brown paper bag and I put the bag in the garbage before I got in home. I took the medicine out of the bag, out of the white bag. There was a brown bag and then a white bag. I discarded both bags in the garbage, and then I came inside with the medicine bottle. And the medicine bottle's on the counter. But I washed my hands after that. So it's all good, Trudy. Welcome in. I appreciate you voicing your opinion. And some people do use caps because of vision or sight impaired. It's all good. Don't worry about it. Welcome. You're welcome to stay and voice your opinions as long as you're not shouting at anybody else or you're not carrying on. You're always welcome, Trudy and everybody. I have my good friend from Linda from up in Canada. She puts capital letters all throughout the whole chat, but she can't see well, so she puts it in there like that. Joey Brooklyn washes his money, so don't listen to him because he is OCD like a mofo. Joey Brooklyn washes all of his money, and he gets piles of money every day. So Joey Brooklyn washes his money. So if you want, you could do that. If it makes you feel good, do whatever makes you feel good. They're adults. My sons are adults.
Situation, different states, different hotspots. I guess to put a fine point on it,
hi, Sheila.
Is it in the realm of possibility at all that the White House and the task force could say in 30 days, that's it, we don't have these guidelines anymore, you don't have to social distance anymore, it's over?
In my opinion, I think that in 30 days, we will still be telling the country in general that you need to practice these measures, but in 30 days, some places may not need to have a shelter in place anymore. So again, we'll start to ease this in 30 days, I think, but in some places, but in other places, we'll be ramping it up. We'll follow the data, and we'll go on based on what the data tells us.
Okay, let's talk about ventilators. We know that there aren't enough ventilators, unfortunately.
Jana Cabana, yes. So because of my police career and Marcelo, Luke, who's here in the chat, him and I worked on the front lines together. I know all about germs and things of that nature. I raised 2 kids, and I'm a germ phobe. Diane Dookie 4000 can tell you. I am a clean freak, so I'm always cleaning my hands prior to this all happening. Prior to the virus, I wash the crap out of my hands, always. And I never touch my face when my hands are dirty. Well, I can't say never, but I'm sure I've touched my face when my hands dirty. But guess what? Now I don't do that. I will never touch my face anymore. So asymptomatic carriers can really spread it. Yes, that's true. We all know that. Somebody can exhibit no symptoms and spread it. So limit your contact, social distancing. Only people I come in contact is with my family here, my little bubble, and I'm not socializing with any of my friends. I do a lot of Zoom video meetings with my friends and my sister and my brother, but that's the extent of who I see and who I deal with.
Let me tell you what Governor Cuomo of New York said is the scenario right now as states like his try to get ventilators. Let's roll that.
So you have 50 states competing to buy the same item. We all wind up bidding up each other and competing against each other. It's like being on eBay with 50 other states bidding on a ventilator.
Now, the fact that there aren't enough ventilators is perhaps nobody's fault, but isn't there a better way for states to go about getting these ventilators?
I have Zoom.
Well, that's a great question. I talked to the head of the stockpile just this morning, and we're trying to work with governors to come up with a better way. We're trying to purchase what we can for the stockpile and send it to places like New York that need it the most. But we're also trying to make sure other states and governors can get priority purchasing at a reasonable rate. So I think the governor of New York makes a raises a fair concern, and it's one of the things that we're working with to try to make sure the equipment can get to where it's needed in an efficient way and without price gouging.
And this finally, Dr. Adams, I mean, you're a physician. This is your life's work. I just have to sit with these numbers for a moment. In the best case scenario, the White House is saying we may have 100,000 deaths. Right now, there have been just under 4,000 deaths in this country. Are we looking at 96,000 people dying in the next few weeks?
Here's what I want you and America to know. Those projections are definitely sobering, but they don't have to be our reality. If we really do our
Okay, this is where I have a problem with these numbers. You know, here's the Surgeon General saying those numbers are sobering, but they don't have to be our reality. So why in God's name put those kind of numbers out and have fear? They may have in their thought process. Stephanie, thanks for joining. Red Like Wine. Ann Hicks, welcome home to your family. We're always going to be here, so no worries. It's always great to see you back. Don't put those numbers out to instill fear. You know, I don't agree with this concept. I feel that, you know, there's a lot of men and women that are home alone, and don't have a lot of people to bounce things off of. And they see stuff like this and just shit themselves. And they're just like, oh my God, 100,000 people are going to die in 2-3 weeks. That's a bit extreme. You see the morgue trucks outside the New York hospitals, the trailers, right? I watched a news report tonight that showed 20 or 12, I think it was 12, excuse me. It was 12 refrigerated 18-wheelers outside of, I think, St. Barnabas or one of the hospitals. I don't remember the hospital, but it was in New York City. Now, those are there because of these numbers that are being projected. So they don't want to have less equipment and less things in case there is that many bodies where they're going to need to use these vehicles, these trailers. So they're over prepared right now. I know how the city works. They're over prepared for the worst case scenario. So it just is a perception. It's perceived by us, the public, as a scary thing, but they don't want to be caught with their pants down, so to speak. So you need to have these trailers there. It doesn't mean they're going to be stacked up or they are stacked up with bodies. We've seen some of these fake videos where hospital workers are dragging bodies across a trailer. They don't do that. It's all done with dignity and respect. So that could be old video, and people share this crazy crap with me. Today they showed bodies being brought out on stretchers. We don't know if those were deaths from a heart attack or cancer patients. I feel that if it was a COVID patient, it was Bellevue. So I feel, yes, I remember it now. Thank you, Darlene. I feel if it was a COVID patient, there would be a lot more protection on people, and it wouldn't be just wheeling them out on a stretcher with guys. There would be, in other words, it would be a lot more protection. So those could have been natural deaths, elderly, sick, cancer, heart attack, stroke, whatever the case may be, car accident. We can't always assume that these are COVID patients that they're wheeling out. Chances are they might be, but who are we to speculate? And what's the sense in speculating? If they have those, listen, after September 11th, I saw rows and rows of trailers for body parts and recoveries from the World Trade Center site. I was there at the chief medical examiner's office, and I'm sure Marcella was there. We did the detail as detectives. There's nothing worse than being caught with the least amount of equipment to handle a situation. So they are over-prepared, and that's a good thing. So don't take that and start getting fear over that these trucks are going to be filled up. Funeral directors they take big caution, and they're overwhelmed with a lot of business right now, because they don't know what to do. If one of their workers gets sick, then their business is shut down. So they're taking extreme precautions with this stuff. Funerals aren't being attended by more than 3 people, family members. This is not a good time to have a die of a natural death. I'll tell you that right now. So everybody stay healthy and stay alive and follow the rules. Follow the rules and everything will be fine. I guarantee you that. Jack's mom says, I measure the amount of news I watch in order to minimize my anxiety. I'm just following the guidelines being set forth. That is great, sensible information. Now, Jack's mom has gone through a bout of COVID, not a positive because she didn't have a test, but she had all the symptoms and she was very sick. So I'm thankful that you are back and healthy and here with the DutyRon family. So kudos to you, Jack's mom, and I'm glad that you're better now. Much love and respect always.
Stay at home, social distance, then we can flatten our curve even below those projections. Those projections are definitely sobering, but they don't have to be our reality. If we really do our part, stay at home, social distance, then we can flatten our curve even below those projections. But it really depends on all of us. And I commit to you all as Americans that as Surgeon General, I'm going to do my best to get you the information you need. We're going to do our best as the task force to make sure the federal support is there. But we need state and we need local people to come together with federal support to make this possible. Those numbers don't have to be a reality.
We're all in it together. Again, Dr. Adams, thank you for your work.
So good information there. Good, sensible information. This is the kind of stuff that I want you guys to see. I'm not showing, listen, guys and girls that are here, you know how I am. I am not here to instill fear into you. If there is a point in time where I have to get real with you and say that we have a real serious situation and you'll know about it because I'm not going to hold back. If it comes to that, you guys will know individually. I will message you guys and I will do a live. I hope to God that I never have to do that live. But right now, there's no need to panic. There's a very strong need to heed the warnings. Use common sense, communicate with sensible people like myself and others that are here. If you're not sensible, you're not going to be hanging around here and listening to me or interacting in this conversation. So I assume that the bulk of us here are sensible people, but we do have we're human, so we get anxiety and we get scared. Fear is created by watching the nightly news. So I'm gonna segue on to a positive video that is New York Strong. This is backed by Governor Cuomo and by the people of New York. This is an inspirational video from the front lines here, the most strongest hit by far state in the country. We have more cases than many other nations have just here in New York. We are strong. We are resilient. We have had many situations in the past that have tested our resilience, and World Trade Center, September 11th, all the different things that go on here in New York. And, we are strong. We are one. We are a nation that's going to fight together, and we are going to take care of and look out for one another. And you guys have my word that I am here for you. Those of you who know me know I'm not full of shit. For those of you who know me know that I'm here for you. When you send me a DM, Jana Cabana, thank you so much. Thank you for spreading common sense with wish everyone could hear you. Well, I'll leave the replay up so you could share it out with your friends. Thank you so much for that generous super chat. I appreciate that. But those of you who know me, if you send me a message and it's sensible and it's reasonable, I'm answering you. I might not answer you right away, but you got a friend in me because you know that I'm going to answer you. So let's watch this inspirational video, and then we will segue off. And I'm going to say this at the end of this video. You know what I'm going to sign off at. But if you're not subscribed quickly to my channel, please hit the subscribe button, hit that notification bell. All things DutyRon. Follow me on Instagram, Facebook, Twitter, and Snapchat. All one word, DutyRon. I do have a Snapchat and a Discord group. So let me find this video to play for you guys. You guys are going to love this. This is a New York Strong video. Are you kidding me? Hold on. It says the video is no longer. Hold on. I'll find it. I don't give up. Kidding me? But I saved it. I always have. Let me see. My wife shared this with me. I want to share it with you guys because this is awesome. Bear with me here. Oh, okay. I got it. I got it now. I got it, kids. DutyRon doesn't give up. I never give up.
When you are united, there is nothing you can't do. And because we are New York tough, we are tough.
Hold on.
You have to be tough. tough. This place makes.
Good God. I'm going to get it, guys.
When you are united, there is nothing you can't do.
I want to get it large
And
screen.
because we are New York tough, we are tough. You have to be tough. This place makes you tough. We're going to make it because I love New York. And I love New York because New York loves you. New York loves all of you. Black.
I can't get it large. I want it large size. Give me it large size. Fuck. All right. I'm going to figure it out. You guys talk amongst yourselves. Just look at me look like an idiot here. I'm going to get this. Why is it not allowing me to make it big screen? I got it.
When you are united, there is.
Everyone's laughing. Supersize her. All right, we're going to have to look at it in small size.
Nothing you can't
Josh
do.
is sending me a message.
And because we are New York tough, we are.
I can't zoom in, Josh.
Tough. You have to be tough.
Man.
This place makes you tough.
I had it large.
We're going to make it because I love New York.
Hold on. You guys are killing me.
When you are united, there.
All right, I'm just going to play.
When you are united, there is nothing you can't do. And because we are New York tough, we are tough. You have to be tough. This place makes you tough. We're going to make it because I love New York. And I love New York because New York loves you. New York loves all of you.
This sucks.
Black and white and brown and Asian and short and tall and gay and straight. New York loves everyone. That's why I love New York. It always has, it always will. And at the end of the day, my friends, even if it is a long day, and this is a long day, love wins. Always. And it will win again. When you are united, there is nothing you can't do. And because we are New York tough, we are tough. You have to be tough. This place makes you tough. We're going to make it because I love New York. And I love New York because New York loves you. New York loves all of you. Black and white and brown and Asian and short and tall and gay and straight. New York loves everyone. That's why I love New York. It always has, it always will. And at the end of the day, my friends, even if it is a long day, and this is a long day, love wins. Always. And it will win again. When you are united, there is nothing you can't do. And because we are New York.
Folks. That was a good one. I wish that I would have been able to get that large for you, but you guys got the idea. So again, we are tough. We're going to get through this. We're going to get through this together. New York strong. Listen, guys, we got to stay together. We got to lift each other up. If you know somebody who's having a hard time, reach out to them. If you haven't spoke to a friend or a family or a loved one, send a message, reach out to them. I'm here for each and every one of you guys, and you know that. Love always wins, but when we have strength in numbers, we are one. So may God bless America. May God bless the world, and God bless each and every one of you guys. We are going to be okay. I know it. I can feel it in my heart. I can feel it in my heart. So again, if you need to reach out, you can go onto my website, DutyRon.com. You can follow me here. Follow me on all social media. All one word, DutyRon. I give you much love and respect in the videos that I do. And I appreciate each and every one of you. I know you have options, and there's many other people who go live. So I'm honored, and I feel privileged that you are here watching me. Thank you. Thank you, Diane. You look good. You look good with the hat backwards. Is that what you're saying? You look good with the chat over you. Okay, with the chat over you. I gotcha. So thank you, Diane. That's very nice of you. All right, guys. Again, much love and respect. Thank you for joining, and I will catch you on the next one. An hour and 16 minutes. I think I've overstayed my welcome. So, guys, everyone have a safe weekend. Stay well. Stay healthy. Follow the rules. Follow the rules, and we'll be okay. All right, guys. Be safe. God bless.